Hello everybody, welcome to BD Nurse eCorner channel. So now we are going to see another new nursing theory which is being utilized in all the medical surgical wards. So going on to the session, we are going to discuss on Virginia Henderson's theory. This is actually based on the need-based theory. So this was actually being introduced by Dr. Virginia Henderson in the year 1897 to 1996. She was also coined as the first lady of nursing, or we call it as the Nightingale of modern nursing. Actually, Nightingale founded the modern nursing, but after a decade, this person who came and described the need-based theory was called as the Nightingale of modern nursing. She also, moreover, gave the new definition on nursing, such as assisting the individuals in activities that will be aiding to contribute to health, recovery, or to peace. So, coming to the background of the theory, this theory was being published in the year 1966 on the Nature of Nursing magazine, and in this, it emphasizes that patient needs it's always dependent on the patient independence, and this theory is always accompanying, or you can, it is moreover very close to Maslow's hierarchy theory, where when an individual is meeting the basic needs, the patient will be able to attain physiological needs, then finally the psychological needs, and finally self-actualization. So she also coined the name, or we call it as the nursing definition, as it is the unique function of the nurse is to assist the individual, that is the sick or well, in the performance of those activities contributing to health or recovery that he would perform unaided if he had the necessary strength, will, or knowledge. So in this definition, she is giving that the nurse's ultimate role is not only to assist the sick, or might be who is healthy, or any individual. We are actually focusing towards health as well as recovery, and mainly we are going to give this assistance wherever patient is not having the strength, might be physically or mentally. So the basic assumptions behind the theory is that nurses care for patients until they can care for themselves, right? So they are always focused towards the patient care. So always here the patient is going to be viewed from the nurse's side as a person. So it is going to cover in all the major three aspects, which is body, physical, mind, which is mental, and spiritual. So health is the ability of the individual who is able to do his activity independently, might be the basic needs such as bathing, dressing, grooming himself, eating his food, doing the daily activities, and so on. So here, nurse is going to be as a substitutive role, or might be acting as a supplementary role, or in some instances can act as a complementary role. So this I have given certain examples in the end of the slide. We will be discussing in the end of the PPT how nurses are helping by the founder, that is Virginia Henderson. So in this theory, you are having the 14 components of Virginia Henderson's theory, such as starting from respiration. So any individual must be able to breathe normally. Eat and drink adequately, that is, the basic nutrition needs must be met. Then followed, so once they are having good respiration, eating their food adequately, then the next important thing, whatever is being eaten, it must be metabolized and it must be eliminated. So eliminating of body waste, as well as during the care or during the necessary procedures, how the patient is able to move and maintain the desirable postures, whether the patient is having adequate rest and sleep, whether the patient is able to dress and undress himself in case of when they are sick, and maintaining the core body temperature throughout normal, and keeping always the hygiene of the skin even when they are having excessive perspiration, and also trying to avoid danger or avoiding others' injury. So, safety, enhancing the patient's safety, adequately communicating with the patient by expressing whether he or she is able to express their own emotional feelings, and worship to one's own faith. So, if they are a Christian, they must be allowed to read the Bible. If they are in Islam, they must be allowed to read their Quran. Or if they are Hindu, they must be allowed to read their holy books, such as Gita. And also work in such a way that there is good sense of accomplishment for the patient as well as for the nurse, and also the patient must be able to participate in many of the recreation activities if given so, and also the patient must be able, we have to be able to easily satisfy the curiosity of the patient needs, which is focusing towards health as well as healthcare facilities. So the basic role of a nurse is that might be, as I told you, as a substitute or supplement or complement role. So doing for the patient is the substitute role. Might be if the patient is bedridden, then we are going to give a sponge bath. The patient is comatose, then we are going to give a oral hygiene, perineal care, and so on. Supplement is that helping the patient. Might be he needs some assistance. The patient, if you go and just help him, like might be positioning the patient, or might be helping him to transfer himself from bed to wheelchair or wheelchair to bed, and vice versa. Complementary role is that working with the patient. You are just giving some instructions and the patient is able to do so. Might be doing deep breathing exercises, using the spirometry, then changing the position and so on. So the main goal in this is that it is going to promote independence of each patient depending upon their level of tolerance. So in nursing practice, this assessment can be is always based on the 14 basic needs, and care plan are designed to restore independence. For example, if you meet a patient who has undergone a surgery, then you're going to assist with mobility, elimination, eating, respiration, maintaining the hemodynamics, and so on. So the basic strength and limitation behind this is that the patient when you use this theory, it is very much clear and practical, and it can be widely applicable in all the clinical practices, and also it focuses on the patient-centered care. And coming to the limitation, it is not addressing the spiritual and the cultural variations very deeply. It is oversimplifying the complex health needs as well as assumes all the patients aim for independence. So, to end up with this case study example, I would like to quote out, that is, patient with stroke, nurse helps with feeding and might be movement, that is moving from one place to another, communicating, and so on. So, gradual independence will be encouraged through rehabilitation techniques. So, to conclude the theory, Henderson's theory is based on the holistical needs, need-based theory, as well as patient-centered theory. So the main goal here is that independence in health, where a patient is able to take complementary assistive roles and so on. So it is still highly relevant in modern nursing. So here you can see the concepts of Henderson's, where health is being considered, where environment is considered, and person as well as nursing. So thank you all so much for your patient listening. For any other queries or comments, please don't forget to put it on in the comment box. Thank you so much.